Hello, everybody. I just had the sweet Dr. Danielle Bailey on, and we talked about all pelvic floor dysfunction. We talked about Kegel exercises. Are they right? What causes overactive, musculature when it comes to, overdoing it with these things? She teaches you exactly what she does in practice to assess the pelvic floor. We even got into some of the common symptoms and causes. So please take a listen. I really feel like you're going to enjoy it. And thanks, Danielle, for coming on. So we have Danielle Bailey here. We're going to be talking all about pelvic floor. So why don't we first dive in and talk a little bit about, okay, what is the pelvis and what is the pelvic cavity?
Yes, absolutely. So the pelvis is basically an area in which it sits between the trunk and your legs.
Mhm.
And inside the pelvis, we have the pelvic cavity. So inside the pelvic cavity, it's a space where we have muscles, we have different organs like the bladder, we have the uterus, we have part of the rectum in there, and it provides a lot of different functions. And so when we think about the pelvic floor, excuse me, the pelvic floor is basically the basement in which it supports those internal structures. So it's the bottom part of the pelvic cavity that helps to provide support of these internal organs, provide aid in sexual pleasure, and it also helps to reduce continence or maintain continence, if you would. So these are the muscles that are important for helping us not to pee and poop on ourselves.
Yeah, we don't want that. Although it's very common, right? Like I see this all the time with patients, and I almost feel like it's made out to be a normal process. Do you feel that way too, or see that with clients in your practice?
Yes, a lot of them will come in and they'll say, "Oh, this is just the badge of honor that I'm supposed to receive," you
Yeah,
know.
yeah.
For some people, if they've had children, but there's often times where clients will come in that have never had children, that have never been pregnant, that'll still experience these issues. And so a lot of times people will come in thinking like, this is my norm, this
Yeah.
is how it's supposed to be, and I'm just supposed to accept it.
Right, right. So what are some of the main functions of the pelvic cavity?
Sure. So for one, it's kind of that middle section between the trunk and the legs. So it's important for women, if you do decide to have a child or bear a child, it will support inside the uterus is where the baby sits. The other important function is for us to be able to urinate and have a bowel movement. So the pelvic floor is responsible for those functions as well. It's also important for sexual pleasure. So for some people that may have struggles with achieving an orgasm during intercourse, we work on how to fully relax the pelvic floor so that you can experience that sexual pleasure. So these are kind of the main functions of the pelvic floor.
Yeah, and if let's say someone is thinking, "Oh my goodness, is my pelvic floor one of the big issues that I'm, having, or what type of symptoms, will they be dealing with?"
Yeah, so some people will come in and they'll say, I'm noticing every time I cough and sneeze, I'm leaking on myself.
Right.
I wasn't having this before, but now every time I cough or sneeze, I'm just peeing on myself. Like, what is this?
Yes.
Uh, I'll have some people that'll come in and they'll actually complain of every time they have a bowel movement, they notice themselves have to wipe and wipe and wipe and wipe in order to get clean.
Right.
So sometimes there's not enough closure in the anus to prevent stool from seeping out. So that could be another problem for people. Or maybe they've had a bowel movement and then 3 hours later, they notice some smearing on their underwear. So that's also a pelvic floor problem.
Wow.
Yeah, very common. Some people will complain of pain with intercourse. They say, every time I have sex, it's unbearable. It's just really uncomfortable. I just force myself through it because, I want to have this relationship with my partner, and they just muscle through it.
Yeah.
And unfortunately, excuse me, that is not a normal thing. You
Yeah.
shouldn't have pain with intercourse. I can recount some times with clients that have come in that have had this issue for over 10 years with their partner. They've never been able to have intercourse
No.
because it's been so painful. And
Yeah.
it's sad to see people go through that in which they never knew there's resources out there for them to help resolve this issue. So it's something that's very, very sad and disheartening to see people go through. But the beauty is when they come to pelvic floor therapy and I walk with them through this journey, at the end, they're like, I can have sex and it's not painful.
That's
And
amazing.
now I can actually try to have a baby because that was a goal for them. So
Yeah, you don't think about those things, right? That, the pelvic floor could be a huge issue when it comes to that, right? So patients
yes,
just suffer in silence, especially when it comes to sex. It's a taboo topic, right? Wouldn't you say?
yes, yes.
To themselves. So that's so great. I wouldn't have made that connection even myself with patients.
Yeah,
So thank
yeah,
you for that. Um,
yeah,
can we go a little bit more back on incontinence a little bit? So what exactly is it and why does it happen?
sure. So there's several reasons to incontinence, or several causes
Yeah.
for incontinence, but I'll talk a little bit about what it is. It's basically an inability to hold in urine or stool. So we can have urinary incontinence where urine actually leaks out without your volitional control,
Yeah.
or it could be with stool as well. So there's fecal incontinence and there's urinary incontinence. And so there's a couple reasons why it can happen. One, it could be because the muscles are weak. So they're weak and they're not able to support, those pelvic floor muscles are not able to support the bladder effectively. And so what happens is when we're supposed to keep everything shut when we're supposed to, we don't. It just leaks out.
Yeah.
So one problem could be that the muscles are weak and that's what's causing either urine to seep or leak or stool to seep. Another reason why someone can experience incontinence is because of what we call a prolapse or a pelvic organ prolapse. And this is where those internal structures in our pelvic cavity can descend a little bit. And so they're not supported by those muscles. And so oftentimes, for example, if you have a bladder prolapse where that bladder is coming down towards the vaginal opening, people will feel this heaviness or pressure. And because there's not that support, you can also have urinary leakage. Another reason why someone can have urinary leakage or incontinence could be because there's extra tension inside the pelvic floor.
Okay.
And that's actually causing issues, putting more stress on the bladder and increasing someone's predisposition to having to go more frequently or experience leakage. So it could be a weakness issue, but it could also be a muscle tension issue. If I have all this extra tension inside my pelvic floor, that could be causing the leakage as well. I've even had clients with who've had a C-section, and they're like, I've been Kegeling after the C-section to help with the urine leakage, and it's not getting better. So I'll tell them, I'll say, you know what, I want you to stop doing any Kegels right now. That's not helping you. Let's work on reducing this scar tissue
Yeah.
that's surrounding your pelvic floor and surrounding your bladder that's increasing this pressure, which is making you, go to the bathroom all the time. So there's several reasons for urinary leakage. And I oftentimes tell people it's important to adequately get assessed
Yeah.
because I've had numerous clients come in, even this week, who said, I've been Kegeling, I've been doing it.
Yeah.
And I'm like, no, I don't want you to do that right now,
Yeah.
So it's very important to be able to get adequately assessed so we know how to support the issue, the root cause of the pelvic floor problem.
That's great. Yeah, you definitely want to make sure you're figuring out the root drivers, right? With
Yeah,
any health. Um,
yes.
do you find, especially with incontinence, do you see it even in kids or young people? Because I hear of this too.
Yes, I do. There'll be clients that come in that they're like, every time I laugh, I notice myself peeing on myself. I don't know what's going on.
Yeah.
And when we laugh, we actually put pressure on our pelvic floor,
Yeah.
and that's what causes us to lose urine. For some clients, it could be that are younger, for some kiddos, It could be the way they're having a bowel movement. Maybe they're straining all the time and there's some constipation going on. And so every time they're going to the bathroom, they're just pushing and they're straining. That's the cause of this urine leakage. Because what happens is when you strain and when you push, you cause those internal organs to come down a little bit, that prolapse we were talking about, and
Yeah.
that will increase the risk for urinary leakage. So I do see it in kids a lot, and oftentimes when working with them, we work to create a healthy, I call it bladder bowel diary, where we're eating the foods we should eat, we're using the bathroom at, appropriate times. We're not
Right.
going every 15, 20 minutes. Maybe we're using a stool or squatty potty when we're having a bowel movement to aid in the evacuation of the stool so that they're not straining and so that they're not increasing the risk for prolapsing and causing this urinary leakage.
Yeah.
So very common in children as well.
And do you find too with kids, they're often holding it in, like especially with urine and bowels, if they're too busy to go to the bathroom? Do you find?
Oh, yes.
Yeah,
Yes. Yeah, very common. It's like they're too busy playing and having a good time. They don't want to take time to go to the bathroom.
exactly. Hide and seek. Don't you remember that?
Yes.
Those things. You can't take a break. So yeah,
Exactly.
that's
Yes.
that you've been helping kids and working with kids. That's amazing. And most, when people think of incontinence or this, they think of, older people or pregnancy or things like that. They're not necessarily making the connection with children. So that's important to
Yes.
understand, right?
Absolutely. It's across the whole lifespan for
Yeah.
sure.
So
Yeah.
let's get into the old Kegels. Are they the solution to pelvic floor dysfunction?
Yeah. So Kegels are not the
Okay.
solution to pelvic floor dysfunction. And it was developed by OBGYN, and it's a non-invasive way to contract the pelvic floor, which I get, and there's nothing wrong with being able to have that awareness on how to perform one.
Mm-hmm.
But it is not the solution to all pelvic floor issues.
Yeah.
And I think that's a really important point to emphasize, in that when you are having pelvic floor issues, we need to find out the root cause of the pelvic floor issue versus just treating it with Kegels. I'm going to do Kegels all the time, and that's what's going to help. So when patients come into the office, I do assess for it. I look to see how you contract the pelvic floor through an internal exam. I see how you relax the pelvic floor. I test to see, can you hold and endure a muscle hold? I check to see, can you do short, quick contractions? So I test for that.
Awesome.
And sometimes when patients come in, they don't even know how to engage. I teach you how to engage it. But
Okay.
there's oftentimes too when you're overly recruiting the muscles, when we need to actually calm down the over recruitment of muscle. And so in that case, I say, you know what, I don't want you to do the Kegels, because what's happening is in some cases, you are causing extra tension in that pelvic floor, like we talked about a little bit ago, which can
Yeah.
increase your susceptibility for urinary leakage. So super important to make sure that, one, you have the awareness on how to do it, and that it's prescribed when indicated, but also know that there's things that we do throughout the day in our normal functional movement that performs a pelvic floor muscle contraction. So
Okay.
it's not always like, oh, I gotta lay on the table and do Kegels all day.
Yeah.
It's, there's other things that I do that naturally engage the pelvic floor.
Okay. And there is such a thing as overactive pelvic floor that you see with, right? Can you explain
Yes.
a little bit of that, or is this a similar to that?
Yeah. So in fact, this week I had a lot of that. I don't know. It
Oh,
just
okay.
came all this week.
Yeah.
But I'll have I had a few clients that came in and they were complaining of leakage and some pelvic pain. So I kind of asked the question, are you Kegeling every time, you're doing exercise in the gym? And they're like, yeah, because, I don't want to have leakage. And when I test the pelvic floor internally, I'll see just a whole like bulk or tense muscle just contract when
Wow.
I'm testing for the muscle. And
Okay.
I'm like, okay, we need to work this out a little bit. I don't want you to do that anymore. Let's stretch you out. So I'll do some internal manual stretching to calm things down. And then when I'm done, they'll feel like, oh, that actually feels better. It doesn't
Yeah.
feel as tight in there. And so I'll work to stretch out the tissue before we can effectively strengthen the tissue.
Okay.
And so it's important to teach patients that hey, you can be overdoing it, and
Yeah.
sometimes all you got to do is calm it down just a little bit before we effectively work out the area.
That's great. So, do you work with the Kegel weights? What are your, your opinions on the jade eggs, all those things?
Yes.
Yeah.
So when I recommend patients to use the Kegel weights, I don't recommend that they keep it in there all day long.
Right.
It's typically like a 15 to 20-minute program that I prescribe for them to do. Oftentimes what we'll see on social media or over the internet is that just, keep the Kegel weights or jade eggs in there all day, and that's going to be the solution to your pelvic floor problem. And
Yeah.
I don't believe that. I feel like there's an appropriate time and place for it. I don't prescribe Kegel weights to everybody. I
Yeah.
really do so for people that may have this decreased awareness or sensation in their pelvic floor, and we're trying to build up this proprioceptive feedback for them to understand, oh, this is what it feels like to engage my pelvic floor. This is what I should be feeling when I contract my muscles. And we just do it for 15, 20 minutes, maybe 3 times a week, and that's it.
Hmm.
During the day, I'm not saying you keep that weight in there, that egg in there all
Yes.
day, because you're gonna overact your pelvic floor, and that's not what we want. So it's indicated for some people, and
Mhm.
it's a contraindication for some people. So
Okay.
it really depends on, what we're working to do. Are we working to build up awareness and build up strength in a way that is effective for the patient? Or do we need to calm down the tissue, relax everything before we can effectively engage the pelvic floor?
Yeah. So listeners, who are thinking, okay, if I were to go get my pelvic floor, assessed, what does
Yeah.
that look like holistically with you and your practice? Like kind of
Yes.
through that.
Yes. So I really enjoy taking a holistic approach to helping clients. You can come in, yes, I can test your muscles, I can see if they're weak or strong or tight, but I also like to look at diet. What are you eating
Yes.
throughout the day?
Right.
Are you consuming things that are going to induce urine leakage? For example, caffeinated drinks, sometimes foods that are high in histamine, citrus fruits and things like that. We look to see, are these foods, are these drinks that you are consuming that are causing a problem to the pelvic floor? So I look at that as well. I look at how much sugar intake do you have throughout the day? Are you eating a lot of processed foods? Are you drinking a good amounts of adequate water throughout the day as well? Because all of these play a huge role into your pelvic health. For people that are like coming in for example, constipation, I look at the diet. What are you eating throughout the day? Are you consuming more whole foods, or are you eating a lot of junk food? And is that the issue here? Um, and for some people that, complain of, for example, diarrhea, I have diarrhea 3, 4 times a week.
Yeah.
I'll ask the question in my questionnaire to the patient. I'll say, do you have diarrhea often? They'll say, well, not that much. And I say, okay, well, how many times are you having diarrhea? 3, 4 times a week. I say, well, that's a problem.
Right.
So,
Yeah.
and that can cause, issues of the seepage that you might notice after, having a bowel movement. And so I will say, you know what, I think it would be to your benefit to have maybe a food sensitivity test.
Yeah.
Let's see what foods you're sensitive to, because this has probably been an issue for years for you and you never made that connection to, hey, this food is actually causing me to have these issues. So I
Yeah.
think it's very important to have that holistic approach for patients, not only with food, but also your mental health. Were
Right.
you in some type of traumatic event in your life? And is this contributing to the pelvic floor dysfunction? So having that, being trauma informed and
Hmm.
being sensitive to that, I think is super important, because it gives patients the ability to feel like they're heard, that they're not just a number, they're
Oh,
coming
yeah.
in. And, I'm not just treating the muscle, I'm treating you as a whole person. So
Exactly. And is there is breath work involved when it comes to the pelvic floor?
absolutely.
Yeah.
Breath work is definitely involved. That's one of the things that I assess as well.
Mhm.
So I look to see how do you engage your diaphragm, because there is a connection between your diaphragm and the pelvic floor. So as you inhale, your diaphragm lowers, and
Mhm.
so does your pelvic floor. As you exhale, your diaphragm lifts, and so does your pelvic floor. So they have this mirroring motion, and it's very important for patients to develop that awareness and connection of the breath with the pelvic floor. And so when we do that and they do it effectively, I'll say, do you kind of feel how your pelvic floor is naturally moving
Yeah.
just with breath work? They're like, yeah, I never felt that before. I never noticed that before. And so for exercise, I'll say, hey, I want you to do some breathing at
Yeah.
home. That's all I want you to do
Okay.
is to breathe. And I'll teach them how to, avoid excessive chest rising or abdominal pooching, but to have this beautiful uniform breath that will allow the pelvic floor to move up and down. It'll allow it to shorten and to relax just naturally with our breath work. So it is something that I assess for when patients come in. And oftentimes, if it's a patient that's having pain with sex, I'll say, you know what? I want you to take some deep breaths before you have intercourse
Yeah.
and during, if you can, to just relax yourself to help reduce that tension. So it has multiple purposes, the diaphragmatic breathing.
That's amazing. And oftentimes we're not paying attention to our breath, right? Our breath work. It's often overlooked, especially with stress and all the things that we experience every day, right? So we need to be
Yes.
more cognizant of that. But a lot of us don't know how, right?
Yeah.
So that's
Yes.
definitely a great piece of the puzzle to think about, you know.
Yes.
Um,
Yes.
so, and when you're assessing patients like in clinic, like you're also doing an internal exam, right? When it comes to
Yes.
figuring out imbalances. So that's amazing. That's an amazing piece of the puzzle, I feel. So can you walk me
Yes.
through a little bit more of that too?
Yeah, absolutely. So I try not to freak people out when they come in
Yeah.
and I say, we're going to do an internal exam. Like,
Mhm.
oh my gosh. I said, trust me, it's not as bad as you
All
think.
good. Yes.
You'll be surprised at the end. So I don't use a speculum or anything like that. I pretty much use my finger. The
Mhm.
first thing that I do is I have the patient basically cough for me. Let me see
Yeah.
how the perineum moves just with the cough. I'll have them bear down, and this is just an external view first before I actually go internal so that they'll feel a little comfortable. And
Yeah.
then they'll say, hey, I want you to do a Kegel for me. Can you do a Kegel? Can you contract the muscle? Then if they're able to do that, I will then insert my finger with a little bit of lubricant gel, and I will test the muscles of the pelvic floor. So as I insert my finger into the vaginal opening, I'll ask the patient, hey, do you feel any tension or discomfort? Does it hurt in any areas that I'm touching here? Some will say yes, some will say no. And then at that point, after that, I'll have them take a deep breath in for me. We'll work on that diaphragmatic breathing. How does the pelvic floor feel when they just breathe in and when they breathe out? Is it moving or is there some restriction there? Then after that, that's when I'll test for how they're contracting the muscles voluntarily. So I'll have them inhale, and then on the exhalation, I'll have them squeeze the pelvic floor, or I say squeeze or Kegel. I don't really like to use the word Kegel, so I'll say do a pelvic floor squeeze for
Yeah.
me. What I'll look for, I'll see if there's this excessive recruitment of other muscle groups like their abdominals or their hips or their glutes, or are they able to effectively isolate the pelvic floor when they are doing a contraction. After they contract the muscle, I'll then see how long they can hold it for. Can they
Okay.
hold it for about 5 seconds or not, or does the muscle just let go? And
Mhm.
so that's typically an indication if there is this decreased muscular endurance of the pelvic floor, then it kind of puts in my mind, okay, they're having some of these issues with leakage because they're not able to hold their muscles for longer than 1 or 2 seconds. So we'll do that, and then after that I will have them do quick contractions. Do they have the ability to squeeze and relax effectively, or is it hard?
Yep.
Do I have that awareness to do a quick recruitment of those muscles? And then towards the end of the exam, I'll look for prolapse. So that's when I'll insert 2 fingers I'll have the patient bear down, and then I'll look to see, do I see bladder? Can I feel cervix? Can I feel a little bit of the rectum coming towards the vaginal opening? And that will kind of conclude the internal exam.
Absolutely. That's amazing. Thank you so much for going into that, because it is, I feel, a big missing piece of the puzzle, or isn't talked about often, right?
Yes.
When it comes to the pelvic floor, with even with what I've learned. So this is great that you
Yes.
offer those services. It's great.
Thank you.
And what other kinds of things can patients do at home? So do you do a lot of home care for patients? Because they think about, things that you can assess, in the clinic, but there's a big responsibility that they need to do, right, when it comes to taking
Yeah.
care of their bodies. So kind of walk us through that.
Yes. So I first like to make sure that they have a good diet and they're hydrating adequately. So that's one thing they can do for home that's really important. We also talk about toileting strategies. So
Okay.
I don't want you to squat over the toilet when you have to pee. I'd like you to relax, sit on
Mhm.
the toilet, and use the restroom. Squatting and peeing are not good because what
Yeah.
happens is you're not allowing the pelvic floor to be completely relaxed. So those are some simple things I start with for home. Just make sure, like when you are at home or when you're out and about, that you are relaxed and seated on the toilet. We'll also talk again about how you're having a bowel movement. So are you straining, or can we incorporate the use of like a squatty potty or
Okay.
stool so
Yeah.
that you're evacuating effectively? And then for home, depending on the patient, I'll prescribe certain exercises for them to do. So if someone has like a very tightened pelvic floor, we'll work on more stretching exercises like lunges or, for
Mhm.
example, happy baby pose, things like
Yeah.
that.
Yeah.
If it's for strengthening exercises, I might have patients do like squats.
Yeah.
That engages the pelvic floor. So it does vary from patient to patient,
Yep.
but important things to consider for home is, how am I peeing and pooping? How
Yep.
am I doing that? Am I drinking enough? Am I eating the right foods? Those are simple things you can do for home. Well, I say simple, for some people it's very hard to
It
do.
is. Yeah. Yep.
Yes. And then staying consistent with the exercise program. I typically, when I recommend exercises, I'll say, I want you to do a minimum of 4 days a week
Mhm.
for 20 minutes. It's not super crazy,
Mhm.
but I'll notice that the people that are consistent with that make the biggest
The
progress.
biggest
So,
progress. That's
yeah.
with anything, right? Really having to
Yes.
make those commitments and put yourself first to see big changes. That's with anything
Yes.
in health. Um,
Yes.
for those that don't know what a squatty potty is, can you just explain that a little bit?
Yeah, absolutely. So I like to preface it with saying, back in the day when people used to have a bowel movement, they would go to this outhouse and they would basically just squat on the floor and have a bowel movement. And so nowadays we don't really do that with our toilets the way they are. We just kind of sit at a 90-degree angle, our knees are at 90 degrees, and it makes it a little bit more challenging for stool to evacuate. So the squatty potty is basically a little stool that sits around the toilet, and once you place your feet on that stool, and it allows your knees to pretty much be above your hips. And what that does, it aids the stool in coming out much easier so that you're not straining. And so if you have a squatty potty, great. I also say, if you have little kiddos at home, you can use one of their little step stools that they
Yeah.
use to brush their teeth. That works very well.
Awesome.
So either way, you can use something to just help support your body a little bit better so that the stool can evacuate much easier.
Awesome. So for those listening, they're like, oh, I want to work with her. I would love to, get, possibly go in your practice. So do you work virtually with patients? Is it only, in person? Kind of walk us through if they're trying to find somebody.
Sure.
Yeah.
So if you're trying to find someone, you can go on the APTA, that's the American Physical Therapy Association. So it's apta.org to find someone in your local area by just typing in your zip code, and you can find a pelvic floor therapist in your area. So that's one thing you can do. You can, Google pelvic floor therapy in your area. You'll probably find someone there. The one thing I would recommend is that you make sure it's a pelvic floor therapist,
Okay.
not someone who's just orthopedic based and doesn't have this understanding of how to treat pelvic floor dysfunction, because even though having an orthopedic background is important, you want to make sure they're trained in pelvic floor. I personally do work with patients both virtually and in person.
Great.
Most of my clients are in person, but there's a lot we can do virtually as well.
Absolutely.
Yes.
It's an amazing world for that, isn't it?
Yes, yes. Things have changed,
Yeah.
where you can really optimize the use of telehealth. And so I see patients both ways. The way patients can find me if they want to work with me, you could go to my Instagram at 360_health coach. And there's a link in my bio to schedule a free discovery call where we can talk about some of the symptoms that you're having and see how we can help. Or you can go to the website at www.360hws.com. That stands for Health and Wellness Services.
Awesome. Well, thank you so much. This was so thorough. You're absolutely amazing. I've been following you along for a little bit now. Listen to a couple of your other interviews, and you're just wonderful. And you can tell you really care and you're knowledgeable. So we appreciate you so much coming on.
Thank you so much for having me. I'm so glad to be here.
Yes. I hope everybody has a great rest of their day. And it was nice having you on.
Thank you so much.
Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on drbeckycampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Crystal Hohn. Have an amazing day.